talks are continuing in private circles now on trying to create a fix for the Medicaid Enhancement Tax. As we've talked about before, two lower courts have already ruled the tax unconstitutional. Senate President Chuck Norris essentially didn't let the cat out of the bag, but tried to bring the privately warring parties together behind a compromise. He doesn't have one yet, but he said we've got to, in the short term, reduce the MET, and in the long term, phase it out. Now, how do you do that? Well, like I talked about on the exchange this past week with Steve Norton, the excellent head of New Hampshire Center for Public Policy Studies and former Medicaid director for the state of New Hampshire. You're not going to fix this in one day, and one bill is not going to create a whole new healthcare delivery tax system. What you're going to have to do, in all likelihood, is try and carve out enough of a reduction that will please the hospitals in those negotiations. First, starting off with, you get rehabilitation hospitals out of this tax. That's going to happen in any Senate proposal. Also, I think one other possible avenue for compromise is the Medicaid Enhancement Tax, 5.5%, one of the highest taxes in the country on providers, only on hospitals, in a state with one of the lowest reimbursement rates for Medicaid in the country. So you see where hospitals felt they had no choice but to sue the state once they no longer were getting the money back they were paying in this tax scheme, as they had been for 20 years. But that tax is inpatient and outpatient services. The outpatient is the unconstitutional part. You could tax inpatient because that's a defined class. Other healthcare providers don't have beds. Hospitals do. So you could limit the tax to inpatient services. That wouldn't get you $72 million like the Medicaid Enhancement Tax got the state budget this past year. But it would get you tens of millions of dollars. And it would be a way to basically time out this whole process so that the next governor and the next legislature could come up with a permanent fix.